Hello everyone, and welcome back to our channel. Have you ever noticed a small, soft, bluish bump inside your mouth? It might be a mucocele. While the name sounds a bit intimidating, it's usually nothing to worry about. Today, we're going to demystify mucoceles, exploring what they are, why they happen, and what you can do about them. So, stick around to learn all about these common oral curiosities. First things first, what exactly is a mucocele? Put simply, it's a small, fluid-filled sac or cyst that forms in your mouth. They're typically soft, round, and have a bluish or translucent appearance. You'll most often find them on the inside of your lower lip. But they can also appear on the roof of your mouth, under your tongue, or on your gums. They are one of the most common lesions of the salivary glands. Think of it like this. Your mouth has hundreds of tiny salivary glands that produce saliva to keep things moist. A mucocele forms when one of these glands' ducts gets blocked or injured. Saliva then leaks out and collects under the soft tissue, creating that little bubble-like swelling. There are two main types of mucoceles, and the difference lies in how they form. The most common type is called an extravasation mucocele. This usually happens after a minor trauma, like accidentally biting your lip or cheek, or even from the constant pressure of dental braces. The injury damages the salivary duct, causing saliva to spill into the surrounding tissue. This type is most often seen in younger people, from children to young adults. The second type is a retention mucocele. This one is less common and tends to occur in older adults. It happens when the salivary duct gets blocked, perhaps by a tiny salivary stone, causing saliva to back up and swell the gland itself, forming a cyst. It's like a tiny plumbing problem right inside your mouth. So, how do you know if you have one? The main symptom is a painless, soft, and movable lump. The size can vary from just a few millimeters to a couple of centimeters. They might feel a bit like a small water-filled balloon. Sometimes they can get in the way when you're eating or talking, which can be annoying. If a mucocele is near the surface, it might look bluish because of the pooled saliva underneath the thin tissue. While they are generally painless, they can become tender if they get bumped or irritated. Occasionally, they might burst on their own, releasing a clear, sticky fluid and then shrink. But they often come back if the underlying duct issue isn't resolved. Now, let's talk about a specific and more dramatic type of mucocele called a ranula. A ranula is essentially a large mucocele that forms on the floor of the mouth, under the tongue. It gets its name from rana, the Latin word for frog, because the swelling can resemble a frog's belly. Ranulas form when one of the major salivary glands under the tongue, the sublingual gland, gets blocked or injured. They can grow quite large, sometimes pushing the tongue upward and making it difficult to speak, swallow, or even breathe in rare cases. A plunging or cervical ranula is one that extends downward through the muscles of the floor of the mouth into the neck, creating a noticeable swelling there. Because of their size and potential complications, ranulas almost always require medical attention. So, you think you have a mucocele. What should you do? The good news is that many small mucoceles, especially the extravasation type on the lower lip, will often resolve on their own. They might rupture, drain, and heal within a few weeks without any treatment. However, it's really important not to try and pop or drain it yourself. Doing so can lead to infection or further injury, and the mucocele will likely just come back. If the lump is persistent, meaning it doesn't go away after a couple of weeks, if it's large, painful, or interferes with your daily life, it's time to see a dentist or a doctor. They can accurately diagnose the issue and rule out other, more serious conditions. A professional diagnosis is key. When it comes to treatment, the approach depends on the size, location, and symptoms of the mucocele. For a simple, recurring mucocele, a dentist or oral surgeon might recommend a minor surgical procedure. This is usually done with local anesthesia right in the office. The surgeon will remove the cyst and often the small associated salivary gland to prevent it from coming back. This is a very effective and common solution. Another option is marsupialization, where the surgeon makes a small slit in the cyst and stitches the edges to create a permanent open pouch, allowing saliva to drain freely. Laser ablation and cryotherapy, which uses extreme cold to destroy the cyst, are also modern, less invasive techniques that can be used. For a ranula, the treatment is typically more involved, often requiring the surgical removal of the affected sublingual gland to ensure it doesn't return. To wrap things up, mucoceles are benign, common, and usually harmless. They're just a little hiccup in your mouth's saliva delivery system. While many go away on their own, persistent or bothersome ones need a professional look. Never try to be your own surgeon at home. If you have a lump in your mouth that concerns you, the best and safest step is always to get it checked out by a healthcare professional. They can give you peace of mind and the right treatment if needed. We hope this has cleared up any questions you had about mucoceles. Thank you so much for watching. If you found this video helpful, please give it a thumbs up and consider subscribing to our channel for more informative content. Don't forget to hit the notification bell so you won't miss our next video. Stay healthy and we'll see you in the next one.